here, which is the making uncomfortable condition for us. Before starting to make a surgical operation, we are cleaning the hair. First of all, you can see previous group are removing the adrenal glands. It is the size of that, which is located under the skin. Remember, first of all, when you are doing the surgical operation, never do not touch every place which is the better for you. Secondly, your hand is always up to make a sterile. Otherwise, maybe you are touching some places which is do not sterile, then working in the abdominal cavity and making some infection. Secondly, don't make the clothes under the space of the surgical operation, okay? If you're not seeing well, it is better if you are using the glass there, okay? Otherwise, it is most of the non-clear rubbish is touched to your clothes. Is it well?
Yes. No.
No, of course not. In that case, first of all, always remember, first of all, it is the sterile. Look how long time I'm working, how much time I just touch the table. Never. It is mostly important for you, first of all. Okay? Always making hand up, sterile. Okay? It is not well gloved still. This one. That is okay, anyway. The silicone power is not well. This one is better. Now it is clean. Nice hard filter. You don't want to sleep, dear. Anyway, we are doing. You want or you don't want. We are doing. Wow. There you go. Come, dear, come. Anna,
Yes, sir.
you don't want to assist?
Yes, sir.
Which side is your?
This side.
Really? That was your side?
Okay, sir.
That's
Sir.
what? Push up. Push up. Table push up. From left. Do you see the teeth?
Yes, sir.
Take this. So, as I say, guys, look, first of all, to make our surgical operation, we need to make at first what? cleaning of the space where we are doing our surgical operation. For that we are using the cotton or other one in the people. If they have a lot of hair, we will using some shaver to clear the hairs before starting the surgical operation. Of course they are doing the nurse. First of all, we will little bit drain the hairs to don't share everywhere. Is it visible? Then we are took the scissor, starting to clear. For sure, in animals I am doing by the scissors, but in the people, generally we are using the shaver. Is it clear? It is clear. So, before starting the operation, let's come to remember anatomy. You can come here, you can come here to make a space for everyone. We are only the 5-10 students, not more. Look, who is it? Amna. What is this?
Skin lining.
Really? That is a skin? If you are not telling, we don't know that was skin. What do you see here? Who is it? Midline. That was anatomy. Especially before starting the surgical operation, we are cutting the skin in a midline and everywhere. In a muscle too, we are doing the cutting in abdomen, in a midline. Why? Why we are cutting the skin in a midline pathway, not in other side from the right or left or other cases? Why? What is the majority of this? Do you study anatomy? When? Last year? You get it anatomy lesson well?
Yes.
Really? By your knowledge it is not visible. Because in a midline we don't have no one vascularization and innervation. If we are cutting the skin and muscle in a midline pathway, we don't having bleeding. In that case, what we will do, we take the skin and start it to penetrating, the skin. Is it visible? After which we are starting to cutting by the scalpel. How? We'll inject it the device under the skin. Wow, it is feeling right. Sure, it is paining, but he has anesthesia. Why he is feeling? I don't understand. Anyways, look, always you just find the midline. Is it visible? The midline of that. Now arm nice support me or no?
Yes.
Go on that side. Here, your space only in front of me. Do not forget. Assistant always standing in front of the doctors. What we can do, little bit push up in a where? In a midline. Look, in this side and that side it is visible, yeah? Where is the midline? Is here. Little bit, not too much. Push up. And we are starting what? Cutting the tissues. Push up. Push up. Don't move it. Amnajan. For what I'm doing like this? Could you tell me? For what?
Cut it completely.
No. First of all, to do not penetrate it the abdominal tissue. Amnajan, not making this. Make the strong lining position. You're just using the scalpel or scissors. As you can see, the scissors, they have a acute part and not. In a cutting case, you're just using the acute. So, is it visible? So, what is this? Is it visible, the midline of the body, white lines? So before starting to do, next year we will discuss about the heart, which is the beating, first of all. Do you want to feel it, the beating of the heart? Feel it. In animals, like this. Do you feel it? Do it. She's not eat you, Mariam. Make a finger correct first of all. Remember, always make it correct.
Yes, sir.
Do it. Prophecy. Next time use the long shirt uniform. It is mostly important, remember. In a sergeant, it is important. Okay? He's leave. He's under anesthesia. He's leaving, said that. So I'm a little bit more penetrating in making incision. Pretty small space. You cannot see no one in abdominal cavity. I do myself, wait. So, same manipulation we are realizing with the muscle tissue. First of all, as you can see under the skin we have a smallest vascularization, and to arrest the bleeding, what we are doing, we are using the cold water. Why? Because the cold water, they have an anesthetic effect and they are what? Vasoconstricted, yeah? And as you can see, the bleeding, it should be stopped. Is it visible? So once more we are starting to penetrate the muscle tissue. What we have between the muscle and skin?
Fish.
Fish. Subcutaneous tissue, yeah? It was a subcutaneous tissue. In humans, you just took it dead and cutting. I'm doing my by hand, but you're just using the device. Is it understandable?
Yes.
Because otherwise you're just damaging the tissue. Is it visible how I'm opening? Then we have a different type of the scalpel. Sharp, circular form, and mixed form, yeah, in that case. So I am making incision by the scissors because it is more safe. Otherwise, we have a penetrating the internal organs. In that case, we need to first of all suturing that. As you can see, I just making the incision strongly in a midline pathway. For what? Sorry?
No vascularization.
You are right, because we don't have vascularization. Layer by layer, I am opening and penetrating the abdominal cavity. Look, now we are opening the muscle tissue, functional by using of device. Just a minute, how much? Is it visible? Midline.
Yes.
There are two positions. Always do the condition. We are always using from the down to up, because otherwise we cannot control that. But if you are pushing up, just only the cutting strongly the midline of that. Imagine do the midline pathway, yeah?
Yes. So, Maria,
So what?
I'm feeling
she's feeling this.
Open the window and opening the door. Make air. What is the meaning? Do you have water? Air is not enough for you? Fresh air is clear your
Sir,
condition.
I feel my ears are blocked.
Your ear, close your oral cavity nose and push. No, by hand. Mariam, look at me, close by hand. Is it push it? Drinking water. That is a strong pressure changing here. Now you are become to normal. No, open the window. Who is telling to close, dear? Strong push down. Strong. Brilliant. Look, Amnajan, if you are removing the device before, then I'm finishing the cutting. I'm just penetrating the inner organs. Is it understood? Now is better, Madam Jan.
Yes, a little.
So let's come to see the inner organs of our abdominal cavity. For sure, in that case, we are opening the muscle tissue. Is it visible?
Yes.
I just making incision little bit bigger by the scissors to help you see better. Otherwise, this to make an operation, this part is absolutely enough. Look, not a sharp, acute part. Mariam Jan, you are not bad.
Better.
Better? Okay. In every condition, let me before. Because when I was concentrating, I cannot fix that. Look, now let's come to little bit push up the muscles to see abdominal organs, yeah? You can see, first of all, that was a small intestine. Now you can see the large intestine. Is it visible? The vascularization is too much.
Yes.
Under here you can see this one, you see? Amna, would you assist me? Don't push up. Look. It's enough. Urinary bladder.
Yes.
Is it understandable? Remove. Now I am little bit remove the intestine outside. It is not a stomach. It is appendix. In animals it is too much bigger. Look. This one is a stomach. Ari said that. You can not see, you come to other side. Yeah, Mariam Jan. Now is better.
Sir, again a discipline.
Look. As I can see, you are sick, dear. Now is better.
Yes, sir.
You can come to see if you want. Stomach, is it visible, the white structure? Liver. Where is your flesh? Do you see the liver? This one is a liver. Dark structure.
Yes, sir.
That was a liver. Is it visible? You do see? Now look, under the stomach we have a spleen. Under this spleen what we have? Kidney. You are right. Is it visible, the kidney? Of course no, because it should be in fatty tissue. Mesentery. Is it visible now? This one is a kidney. Okay, as I said, today we will do the surgical operation. What? We will removing the adrenal glands. No, you're just making to see how we'll do. Of course, first of all, we need to opening the region where we need to make a surgery. We'll move the liver and stomach in a side of it to don't make a problem for us. But before we are a little bit increasing the space of the incision. Fatty tissue. What is this? Catabolism or anabolism? It is result of what? Anabolism or catabolism? Really? Look, that was a kidney. Is it visible? Now Amna is support me. Push and fixed this. Fixing. Is it visible, the kidney?
Yes, sir.
Flesh for me, not for you, dear. Under the in the upper corner of the kidney here, we have adrenal glands. Look, in a fat tissue. Now I will find that. Look, renal artery. Is it visible? The big artery.
Yes, sir.
Is it visible?
Yes, sir.
Renal artery, renal vein. Is it visible? Look, elasticity of that. Do you see? And of course here, in a fat tissue, we have whom? Adrenal glands. Is it visible, this one? Now we are starting to remove Amna by this case, okay? Just a minute. No, it is not. This one is adrenal gland. Is it visible? Cutting. Is it visible? Now we'll remove the adrenal glands. It is little bit half of the rice. rice bean, yeah?
Yes, sir.
Is it visible?
Yes.
Little bit darker gray structure. Yeah? Now to make to absolutely know we are doing our surgical operation well or no, it is the safe or no. First of all, we will opening the pathway of the surgeon. Once more by the cold water we are cleaning everyone. First of all, to fix do we have the bleeding or no? You can see we have a bleeding, yeah? We need to first of all what? Arresting that. Otherwise the animal it can be die. That is a two, they have anesthetic effect. Now it is clear, yeah? So now we'll move back, we will move back our intestine. We don't have problem in future by his location. Starting to future. You want. Look, how we'll do. During the suturing, of course, we'll discuss about tissue, yeah? If we will speak with the soft muscle, we'll do the anatomical case to don't damage the case. Otherwise, we will cutting the and penetrating by the sharp teeth form structure the tissue. But it is soft, it is more lost, and we're using the special that surgical one, yeah? First of all, how we'll have a holder. You started to do like this. Do it. Open, close. Wow, how we'll do it? Oh, never. Look, just one finger, look. Look, heart of the finger by the big finger. Push up, that's all. If you are left hand. If you are right hand, look by the index finger. Fixed, push up, push up, push up. Never, if you are using this, you cannot. Is it vibrated? Fixed. Arisedulikcha. Look, by the this finger, push up. This one is the look. This one is the press. This one is a push. Pushing. Say that. Push. Big finger push down and open. Push. Down, open. Just only push it enough to unclip. Yeah. Look. 1, 2. Not a deep. In the corner, and fixed, look. Pushing by this finger, down, open. If you are left hand, if you are right hand, vice versa, by the big finger. Push down, it will open. Push down, open. Look. Don't creeping me, everything is okay. Do it. Arshijan, you know why you can't. Never do not use the two fingers together. 1, 2. Look, not a deep cross. Look. Just by big finger. Push. That was open. Just only push. That was open. Maria Premjan, now you are feeling well?
Yes.
Can we close the window?
Yes, can do that.
This corridor, you can close the
Door.
notice. Look, needle holder. It is the short to make it easy. How we'll do the movement after the how we'll fixing only always the corner of the needles. Look at you. And left hand, look at me. Holder, you should put little bit back from the center, not in across of that. Little bit back. Always when you do the suturing, the corner is look to you. How? You just take the muscle, put perpendicular, and making this movement. Look. Take the second part, perpendicular, huge. Make a fixation, open the holder, fixed, move. Then you just make it tight. First knot, you just do the 3 times. Future is 2 times. What you do it? Put the holder under the nail, 1 circle, second, fixing, took the corner of the nails, push to the side of the incision, other hand is moved to the other side of the incision, make it tight. If the first one you are doing from the upper side of the needle, second one do to from the downer case, one more, fixed, make a knot. Third one, fixed, and do the knot. Never, this knot is not opening. Then you just took that is a interrupting type of the suturing. Whoever continues to, but we don't have too much nail and I just do it just interrupting cases. Take the nail, push up, look, not like this. Move, turn to see the knot, to don't cutting in the knot, and cutting the nails. One more time, I'm sure, then you are doing yourself. Fixing little bit back from the center, in a corner of that. Take the muscle, push up to don't penetrate it in our internal organs. Make an incision. Second one, making the up. Yeah, penetrating that, cutting the tissue, opening. Is it understandable? If you are not able to do the suturing yourself, you just call your assistant to support you. How? They will take the corner to don't remove, take deeper to the tissue, keep to the tissue. Okay, look, 1, 2, lock, took the cross of that, remove. It's better for you. Move to the one side of the incision, other hand is making the knot. Next one, it is the opposite. Look, 1, lock, I'm locking, removing. Is it visible? Take the corner and make the knot twice. Then future, all it's you are making the twice. Look, turn, knot is visible. Cutting is happening. Is it not understandable? Never do not put instrument in non-sterile spaces. You can suture it like this, Your left hand,
Right hand.
you just do it this,
Yes, sir.
really, or from you.
From your side.
It is in a corner, Amna. In a corner. Open, hold, keep, clip, clip, clipping. Now it is done. Is it move?
Yes. No, sir.
Then, really?
Yes, sir.
You can?
Oh, it's sharp.
It is not a sharp. This one is a anatomical. That one is a surgical. Push up. Put perpendicular to you. Circular one. Just muscle. Perpendicular, second, fixed, hold it, open, remove, 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 okay, just a minute, move, relax, here, remove the needle, make a knot. Never, do not touch the corner of that. Take the nail. Never do not clipping. Took by hand. Amna. Taking by take hand by hand. Yeah, brilliant. Making the knot. One, two. Fixed, open, move to the side of you, brilliant. Now the knot is well, but look how many open nail you are damaging. One knot nail. Do you see how shortest I am using?
Yes.
Is mostly important, otherwise you're just using the 10 nails, you are not huge. Next one. Other side. One. Oops. One. Only one. Look, Amna. From your side, you just do it. One. And fixed. Took the nail and push. Do it. Keep here. Do. One. Fixed, lock, open, never, you can't, why you cannot?
It's stuck, sir.
Yeah, because you are do this. Amnajan, look, this case, one, fixed, this is a short. I am making this not myself. Would you tell you your mistake, Anna?
Yes, sir.
Which one?
I'm doing
Look, I will making the knots in a corner of the muscle. You just do it in a deep part. Always across to the corner. Keep. Look, it is very short in the first look, yeah? Take. Just corner you are fixing. Fixed. Little bit to me. Amna Jan, it is not your space to make to you. I am worker. You just help me. You are not doing yourself. If I'm pushed to me, you just give that space.
okay.
short? No, it's okay. Short, yeah? Look. Is it visible? Other one is making by this case. Just only corner. It's enough. Look. How I am remove? Too much small, yeah? Last one, if it's the short, you can cutting single. One small. Anatomical forces. Is it understandable? During the surgical operation, never you don't touch sterile spaces. Only the assistant opening, cutting. Always doing like this. Dr. Arsen is show you anyways. I will show myself too. Never, do not touch. Then the forceps anyways, you just opening. Yeah? Fixed, took by the. It is absolutely sterile. I'm touching someone? No. It is full sterile, yeah? Took, fixed. Your left, right.
Right.
Right. Do it. Dead.